Happy Halloween! OT Lifehacker here. Are you ready for one of the scariest spooky stories? Okay, it's not actually, sorry, but it is some of the scariest people in the world. Or better yet, the scariest person I met today. So I am working today in the hospital. I am an occupational therapy student doing my level 2 field work in the hospital acute care, and one of the patients I worked with, and just a little blurb here, is that occupational therapy in the hospital helps with daily activities like grooming and going to the restroom and being able to walk so that you can go do the things you need to do in your day. So what I did today was working with a patient who was very upset and a bit disoriented and confused. So all of that combination was a challenge, to say the least, but very enriching, and so enriching that I think it's worthwhile to share. So the person I worked with, they were fortunately not very physically combative. They were a bit like just, shooing me away and whacking at me when I was trying to help them with something, but it wasn't like punching or kicking me, so thank goodness for that. And they had a lot of name calling. So I got called a lot of different names, some I've never heard before. I also got called names of different people, so that could be something. And also the person did a lot of yelling and howling as well. Maybe, full moon tonight, the wolves come out. Just kidding. But there was a lot of demands for different things, irrelevant things, and it took a lot of, well, I'll explain how we got through the session. So we were able to finish the session. The person did well in doing the activities. It took a lot of encouragement, and I came out of the room and the nurse was like, "You're very patient." They're like, "I didn't expect the person to do anything, but you got them to do stuff, and you man through all that." I was like, "Oh, thanks." So really, I've said this before and I'll say this again, don't take it personally. Remember, like I said, that there was some cognitive stuff too. The person was highly confused, and it's good to orient them in the sense that you remind them who you are, or just tell them, "Hey, I'm so-and-so and I'm here to help you with this." And before you do anything, you tell them what you're going to do, and be very clear, direct, say it one thing at a time so as not to confuse them more, and keep calm and respectful. Because with anyone, even if you're confused, you still would not appreciate. It'll be even worse if you're treating the person like they're a little kid. And she did say that at one point, that when I was trying to help her with her legs, that she said was very painful. I said, "Do you mind if I try to lift your legs?" And then so I was lifting them, and she's like, "I'm not a little kid, don't touch me." And so yes, you have to be very careful. And then when touching her bed, she's like, "Don't touch my bed, that's mine." And so there's a lot of things. And how I got through it, and some things that can help you. So like I said, with orientation, reassure them that they're in a safe place. If they're saying that they're seeing things, or if they're calling someone a different name, or they're even calling you a different name, you could remind them who you are, and you should. But if you see that they're not tolerating that well, if they are adamant that you are so-and-so, they seem more agitated with certain responses you give, make note of that and change up your approach. So with her, me touching things, even if I asked and she gave the okay if I'm touching it, she may have forgotten, and so I would say, "Do you mind if I touch your bed?" Then if she says no, then I'll be like, okay, can you grab the blankets yourself? And she's like, no. so then it's like, may I do it for you? And then going through, it takes time, it does. And so this may not be for everyone's approach. It depends on what your goals are. And so for me, it's the therapeutic approach, in that therapeutic use of self. So I'm trying to create a calm environment for her, and that way get her to be more receptive to the therapy and to helping herself get better, and giving her that empowerment that she will get better, that she can get better. And so even if someone is perseverating, meaning if they keep thinking the same thing and stuck on the same thought, you can again orient them, but also give reassurance that they're in a safe environment and that they will be able to get to that point, but it might take time. For example, I mean, this may not work for everyone, but with my person, she really wanted to leave the hospital, and she was confused thinking she was leaving the hospital. We were trying to walk her, but she jumped into the wheelchair, and I was walking with her, and she there was a lot of name calling when she's like, we're leaving the hospital, what are you doing? You're so incompetent, take me outside. And so I reminded her that it's not time yet to leave, we need to work on getting better. And also reassure her that I know, I'm sorry, it's a really tough time for you. And she's like, you don't even know, you don't care. And it's true, yes, we don't know the full story, and we don't know necessarily what she's going through. So I apologize that I'm like, I'm sorry, I don't mean to come across as if I know. Please feel free to tell me about how you're feeling. And sometimes that helps, sometimes it doesn't. Again, gauge the person. And she was very stuck on getting out, and she's like, and so there was a lot of, like I said, name calling, because we were not doing what she wanted. We were not leaving the hospital. She's like, when's the van coming? And I had to keep reminding her. But then also, because she's like, I want to go outside. I'm like, we can take a look at the view outside. Unfortunately, we're not allowed to go outside just yet, and I'm sorry we can't, but this is what I can do for you. And she calmed down a little bit. So again, it's all about finding new approaches that work and keeping yourself calm. Create that calm environment for them, and don't take things personally. So those are the tips I have for you in dealing with the scariest people you may encounter. But also remember your own safety, and if the person seems too scary, then just, if you can walk away, then walk away and find a safe place. If you're not in the hospital and not needing to take care of this person. Okay, bye-bye. Oh, and also please like, subscribe, and share this with others. Bye.